the Physicians Wellness Program. A lot of things are going on in the world today, without a doubt. Everybody's affected, including physicians and hospitals. I don't know if you've been watching the news lately, but there's a lot going on. Actually, there's more than one thing going on at a time, and it has a lot to do with the change in the way physicians are thinking, finally, because there is a paradigm shift about going back to that prevention. This whole health and wellness growth in the industry can no longer be slowed down or stopped. Physicians are finally understanding that. Not only physicians, but all healthcare professionals. It's making a huge difference in so many lives it can no longer be ignored. We're starting to hear about complementary medicine, alternative medicine, ways in which physicians, nurses, chiropractors, podiatrists, medical and surgical specialties can now have additional tools to provide their patients and their families the things that they need to do to become better, healthier, and overall enjoy a life of wellness. The health and wellness industry is probably the only industry in the last 2 to 3 years that continues to grow at an enormous pace. In fact, in this very difficult economy, we're seeing figures such as 8, 10, 12% per year growth in this industry. It cannot be stopped. How do we all take advantage of that? Very simply, the Physicians Wellness Program. It is a way in which distributors, associates can introduce this program to physicians or healthcare professionals, and it then becomes part of their business. They see a revenue stream from the sales of these products through physicians' offices. Now, one of the real key things that's happening in healthcare today, and physicians and hospitals are losing significant amounts of revenue. In fact, December 31st of this year, a pay cut goes into effect for physicians and hospitals. You know, all the last few years, I read all these journals, and we have these bulletins, and there's always a part about physicians' revenue problems. And every year there's this threat of a 2 or 3 or 4% cut from Medicare, who's one of the number one insurers in this country, about pay cuts to hospitals and doctors. Well, every year on December 31st at midnight, somebody votes in a freeze in that pay cut. Well, that's been every year for the last 6 or 7 years. Well, this year there's not going to be any freeze, and they're going to accumulate all those pay freezes or pay cuts that have been frozen, and now they're going to take effect. And that total comes to 25%. Overnight cut in reimbursements to physicians and hospitals. Guess who really needs to look at this now? So physicians' wellness products are nutraceutical products. And I'll talk to you about what they are in a second, that we can get in physician offices, exclusive only to physicians. Because I'm not sure as a physician or a healthcare professional, you want to be offering a product to your patients that they can get down the street at GNC or Walmart or Costco. These are pharmaceutical grade, highly formulated, target-directed products, such as a men's and women's comprehensive health formulation. Things to improve bone density. We have millions of women having problems with osteoporosis. We have a product called Joint Ease to help relieve the inflammation and pain and help rebuild the joint tissue. Okay, we have a product called Prenatal for moms to be, because it's so important to get that folic acid and omega-3. We have omega-3 product. We have a prostate formulation. Again, all targeted nutraceuticals developed so that physicians can now offer their patients. How does this work? You come into the physician's office, and I'm sorry, yes, you're going to wait, and probably going to be waiting longer and longer. Well, you now have a captured audience in a physician's office. You've all experienced this, except if you come to my office, nobody waits. But instead of going and looking at People magazine, Car and Track, last year's Vogue, There's marketing materials. This is part of the turnkey system. Marketing materials, a DVD loop on a flat screen TV on the wall, brochures and information about health and wellness, and specifically physician wellness products. There's a questionnaire that the patient fills out, asking some history about nutraceutical use, some of the problems that they're having. That questionnaire gets into the hands of the physician at the time of the examination. Physician makes note of it and says, here, we've run these tests. These are what you need. Go up to the desk and get your order in. So by the physician recommending these products that he or she provides directly to their patients, the patients can now go and order these products, purchase them directly from their physician, or better still, go to that physician's website, get on an auto ship, and get on those products immediately and never run out of them. You, as distributors and associates, have the ability to earn revenue off the millions of dollars of sales of those nutraceuticals in an industry that continues to grow at an 8 to 10 to 12% growth rate per year, probably more. And with the healthcare industry changing the way it is, I think the opportunity and the potential is really unlimited, because it's time that people are going to have to take responsibility for their health and well-being based on accurate information, their own homework. We have the most intellectually ready patient population I've seen. They come into my office with articles, information off the internet, asking questions. They know what's important, and physicians have to get on board with that because they're going to lose these patients. So the program at Nuvera, called Physicians Wellness Products, will be coming out with a turnkey system that you can introduce to physicians that includes office marketing materials, a display, samples, a display in the office behind the nursing staff or the administrative staff, the ability to have those products sold over the counter in the office or directly online.